Hi, thank you for watching Digging to China. I'm Dongsheng. The pandemic not only damaged people's health, economy, social order, but also wreaked havoc science. Quite a few unpopular scientific ideas were initially dismissed, even ridiculed, only to resurface later in mainstream thinking. For example, lab leak theory and the efficacy of masks. Differences of opinion have sometimes been rooted in disagreement over the underlying science, but the more common motivation has been political, and it is anti-science. Scientific method is the technique used in the construction and the testing of a scientific hypothesis, no matter how outlandish the hypothesis sounds like. The process of observing, asking questions, and seeking answers through tests and experiments is the key part of any field of science. The scientific method is critical to the development of scientific theories, which explain empirical laws in a scientifically rational manner. In the typical application of the scientific method, a researcher develops a hypothesis, tests it through various means, and then modifies the hypothesis on the basis of the outcome of the tests and experiments. The modified hypothesis is then retested, further modified and tested again until it becomes consistent with observed phenomena and the testing outcomes. In this way, hypotheses serve as tools by which scientists gather data. From that data and the many different scientific investigations undertaken to explore hypotheses, scientists are able to develop broad general explanations or scientific theories. Some scientists have raised concerns that the safety risks of COVID-19 vaccines have been underestimated. But for now, the politics of vaccination has relegated their concerns to the outskirts of scientific thinking. Dr. Ladapo is an associate professor of medicine at UCLA. Dr. Rich is a professor of epidemiology at the Yale School of Public Health. They are two of the scientists who raised the vaccine safety concern, and they wrote an op-ed on Wall Street Journal last month. Generally speaking, the safety of medications, including vaccines, is often not fully understood until they are deployed in large populations. Examples include the VAERS, a pain reliever that increased the risk of heart attack and stroke, antidepressants that appeared to increase suicide attempts among young adults, and an influenza vaccine used in the 2009 swine flu epidemic that was suspected of causing febrile convulsions and narcolepsy in children. Clinical trials often enroll patients who aren't representative of the general population. Therefore, the real-world evidence is valuable. Doctors learn more about the drug safety from real-world evidence and can adjust clinical recommendations to balance risk and benefits. The Centers for Disease Control and Prevention and the Food and Drug Administration in the U.S. jointly administer VAERS, the Vaccine Adverse Event Reporting System. This is a database that allows Americans to document adverse events that happen after receiving a vaccine. The FDA and the CDC state that the database isn't designed to determine whether the events were caused by a vaccine. This is true, but the data can nonetheless be evaluated, accounting for its strengths and weaknesses, and that is what the CDC and FDA say they do. The VAERS data for COVID-19 vaccines show a pattern. Among the 310 million COVID-19 vaccines given, several adverse events are reported at high rates in the days immediately after vaccination and then fall dramatically afterward. Some of these adverse events might have occurred anyway. The pattern may be partly attributable to the tendency to report more events that happen soon after vaccination. The database can't say what would have happened in the absence of vaccination. Nonetheless, the large concentration of certain adverse events immediately after vaccination is concerning. The silence around these potential signals of harm reflects the politics surrounding COVID-19 vaccines. Stigmatizing such concerns is bad for scientific integrity and could harm patients. According to data taken directly from VAERS, there are 4 serious adverse events: low platelets, heart inflammation, especially for those under 30, deep vein thrombosis, and death. VAERS records 322 cases of myocarditis within 5 days of receiving a vaccination, falling to almost 0 by 10 days. Prior research has shown that only a fraction of adverse events are reported, so the true number of cases is almost certainly higher. This tendency of underreporting is consistent with clinical experience. Analysis to confirm or dismiss these findings should be performed using large data sets of health insurance companies and healthcare organizations. The CDC and FDA are surely aware of these data patterns, yet neither agency has acknowledged the trend. The implication is that the risks of a COVID-19 vaccine may outweigh the benefits for certain low-risk populations, such as children, young adults, and people who have recovered from COVID-19. In May, the Norwegian Medicines Agency reviewed case files for the first 100 reported deaths of nursing home residents who received the Pfizer vaccine. The agency concluded that the vaccine likely contributed to the death of 10 of these residents through side effects such as fever and diarrhea, and possibly contributed to the death of an additional 26. It is rare for any vaccine to be linked to deaths, so this unusual development for mRNA vaccines merits further investigation. Public health authorities should be forthcoming about the possibility of harm from certain vaccine side effects. There will be lasting consequences from mingling political partisanship and science during the management of a public health crisis. Thank you for watching. Please leave a comment and subscribe to my channel. Just click the subscribe button right here. I'll see you again shortly.